There was a great connection between architecture and health in the West for 2,000 plus years. You're looking at a site, Epidaurus, the classical center for 800 years, which was finally destroyed by the Christians in 497. And before that, for 1600 BC, the Mycenaeans, it was a healing center for Mycenae. So the secret, my crazy hypothesis, is that architecture and health, ever since Stonehenge was a hospital in 3000 to 1500 BC, has been intimately connected to architecture. But it's a lost tradition, so we're trying to reestablish some links. It's a complicated one, and it may explain why the Epidaurus and the Acropolis, where there was another great healing center, had these buildings destroyed, because they were so powerful, because architecture and health were really intimately connected. But we have to remember that since 1953, in the writing on the placebo effect, that the placebo effect works, if doctors believe in it, on 33% of psychogenic diseases. And you could say that, in a way, Maggie's centers are architectural placebos. It's an argument I've given in a paper for Cor Wagner's Symposium. Maggie got her first cancer in 1988, was re-diagnosed with cancer in 1993, given 2 months to live. You see her here with Joe Wei, the architect in Vancouver of the Chinese garden. She helped design that Chinese garden. And her passions, of course, were China and gardens. She had the second occurrence in 2003, given 2 months to live, and more or less curled up to die until, for reasons which I'm not quite clear, decided to fight. But I know, because I was with her, of course, every night and during the day, I know that one of the key reasons she fought, she decided to fight and not give up and die in 2 months, was the information. And the information is a key idea behind hope. The primary information of what's happening with drugs, what's happening with genetics, what's happening in all of the chemotherapies and radiotherapies. As Bob Leonard will maybe say this afternoon, and Bob here, Bob is her oncology doctor and gave her the drugs that she had to have high-dose chemo. I would come with Maggie once a week, and I would thrust in his face about 20 papers like this every week and say, is this going to help? I was a terrible pest. But I say that because, for me, reading Stephen Jay Gould's book on collected essays, where he wrote an essay called "The Median is Not the Message," a pun, and the median and the mean, neither is the mean the message. What Stephen Jay Gould was saying, and he had cancer, and he was given 6 months to live, but he outlived it by living 25 years beyond his death sentence. What he said is, you want to position yourself in the long tail, obviously. We know about long tails today. We didn't know about long tails particularly then, and it was Stephen Jay Gould's article, which really Maggie read, and she pulled out of it exactly the kind of inspiration and hope that was in it. And that was to say, how do you position yourself in the long tail? And one by one of method after another, she managed to, and she lived 2 years beyond her death sentence. In any case, after she died, I thought of naming the centers after Maggie, because she was a patient, and patients should, it's a self-help center. When we were looking at the idea of a center, and we only had an idea of one, we found there were 500 informal self-help groups. And I thought it would be great to name it after a patient, because that would inspire patients to take an active role in their own therapy. She wanted to call the Cancer Caring Center, and I thought, well, that's not a very great idea, because who's going to identify with a Cancer Caring Center? Anyway, I did this. She designed a bird, so I turned it into this chirpy bird with a CCC. And our first one was in an old transformed stable block in the Western General Hospital, designed and converted by Richard Murphy, who stitched through his grammar into the building. So an 18th century building for horses was turned into the first of our cancer centers, opened in 1996, a year after Maggie died. And you can see the all-important view into the kitchen. The kitchen in Maggie's brief for the centers was the place you came in, and it's remained a kind of philosophy of Maggie's kitchenism, I would call it, where you informally come in the door, you don't have to fill out any forms, and you insinuate yourself in those kind of spaces before you commit. That's that kitchen table, and you see Richard Murphy's wonderful spaces in light and color. There's the plan, which he added to later, and we can begin to understand the growing genre of Maggie's. I won't discuss cancer, but obviously more and more people, because we're living longer, are getting cancer. And I think a theme of today's discussion will be that because we are living to 90, 95 on average, maybe some, and cancer is a genetic disease, that if we're successful, really successful, we'll all die of cancer. We'll all live to 120 is the idea. So cancer, like many chronic diseases, has implications for long-term living and for living with cancer, and the implication that a hospital changes from being purely a machine like Charing Cross for curing people to become a more hybrid building. And that's, I think, one of the lessons we learned. This is our second converted building by Page and Park, David Page and others. And you can see it as a spiral of space around the kitchen table. And you can see that we include gardens, in this case a DNA structure, which I designed with a seat. Because genetics is so important, because cancer is a genetic mistake in a typing error in 1 in 15,000 letters can give you cancer, I thought, the primary art should engage with the primary reality. And other designers will see, Christine Facer among them, also believe in representing some realities that recent science is revealing. So one of the ideas then is that Maggie's is a hybrid building. It's a house which is not a home, a hospital which is not institutional, a museum which isn't a gallery. It has art in it, and a church because you have to confront fundamental questions, but it's not denominational, it's not religious. So it's a mixture of at least 4 and probably more building types. One of the buildings that Maggie and I did see, well before she was ill, was the Hospice de Beaune, which you may know is the name also of one of the great Burgundies wines. And we went to the Hospice de Beaune, I to see the architecture, the incredible roof, this op art roof, and Burgundian architecture, 1450, and we went in and found that there was a garden in the center with a fountain, the healing tradition that I've alluded to in the West, a church, and the amazing thing about the church was they had beds in the aisles tilted towards the high altar, so you could partake under red damask and velvet in the religious ceremony in bed. It was really surreal and almost provocatively erotic. You know, 3 minutes. Okay. Well, in that case, I better. I don't get any penalty time for being late. Oh, okay. Well, I will not be able to show you Maggie Centers in that case. I'd rather end just with a few ideas. More and more people, because we're living longer, are getting cancer. Cancer, like many chronic diseases, has implications for long-term living and for living with cancer, and the implication that a hospital changes from being purely a machine like Charing Cross for curing people to become a more hybrid building. And so the Maggie Centers is a hybrid building. It's a house which is not a home, a hospital which is not institutional, a museum which isn't a gallery. It has art in it, and a church because you have to confront fundamental questions, but it's not denominational, it's not religious. So it's a mixture of at least 4 and probably more building types.